You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
Beauty means harmony by visualization. And it would apply to everything in the nature. It is not just the face. It applies to the buildings, flowers, to anything that there's enough balance and coordination between the different segments of any element. And this applies to the face. And it is actually, there's a scientific base for the harmony of the face. And that's exactly what we do. We actually create harmony between different segments of the face. And there's a process called cephalometric analysis that we use life-size pictures and analyze the entire face and decide what is out of position that is causing less than pleasing feeling when we look at something. Again, we apply that same principle to the face. And for example, when we decide to do rhinoplasty, we take life-size pictures and match the nose to the rest of the face. When we work on the chin, there is a scientific way of deciding how much we need to lengthen the chin or bring it forward to look good on that face. And when there's harmony, we get, again, a sense of satisfaction that otherwise would not be achieved. And that applies even to the music. The notes, if they're not coordinated, it's not going to sound good. The same principle applies to, again, to the face. And that's what we use to coordinate the different segments of the face to match with each other. The things that can happen to the face to look less than ideal or imbalanced can happen in the skin level, can happen in the thickness of the soft tissues, can happen in the bones. And by looking at the skin that it is discolored or has acne scars, you don't get the same sense of pleasing feeling that you will get when you look at this skin that looks smoother. So that one aspect. Or if somebody has a chin that it is not projected enough or long enough for the face, it is a disharmony, and that can be corrected. If somebody has, for example, prominent forehead or receding forehead, when we look at that person, we immediately detect that. And we don't even have to look at the profile. Even looking at the front view, we can see that patient has less than ideal forehead. And there's a scientific way of, again, detecting exactly how much the forehead is too prominent or too receding to fix that. Or the eyes could be further apart or closer to each other. In general, the eyes that are further apart are a little bit less disturbing than the eyes are too close to each other to the harmony of the face. So those are the examples. Or if the nose has a hump or it is shifted one side, or the lips that are too thin, or even too thick. But too much volume is not good also. It distorts the balance. The size of the eyes could be too small, too large. All of these are the examples of flaws that can all be corrected in different ways to make the person who may not look attractive to become attractive. If the eyes are too close to each other, they can actually be separated from each other. That's a major craniofacial surgery, and it would have a huge impact. Although you can actually camouflage some of that, meaning if somebody has really prominent nose, meaning nose that is really excessively projected, and it goes straight from the forehead to the nose, those individuals may appear to have eyes closer to each other. If we shave the nose down and set it back, there's going to be an optical illusion that the eyes were pushed apart without really pushing the eyes apart. That is actually one of the most impressive and impactful aspects of rhinoplasty, that a good rhinoplasty results actually reflects on the eyes more than anywhere else in the face. And again, a too narrow of nose is going to make the eyes to look too close to each other. If we can widen it, it's going to make it better. The reverse is true also. If the nose is too wide, make the eyes ostensibly look further apart, but they are not further apart. And when we narrow the nose, all of a sudden the eyes look prettier without even touching the eyes. And it is one of those dynamic changes that occur that I've been focused on for 4 decades and writing articles about it and studying it. And it is incredible what the nose, a good nose, can do to the face without really changing the other structure. So it is not always necessary to do complicated surgery to achieve some of the objectives of harmonizing the face and making the face to look prettier than it is. Actually, there's a distinction between beautiful and cute. A person who's beautiful is the person on whom all of the structures of the face are harmonized. Or if there are any flaws, they're very minor flaws. An attractive person is, a cute person is somebody who has very pretty dominant features of the face. And two of the facial features are very dominant. And one is the eyes, and the other one is the mouth and the lips. Cute people are individuals who have really attractive mouth and the tooth relationship, pretty eyes, but the rest of the face may not look great. And there could be some even major flaws with the other parts of it. But they look good and they're cute. But on the other hand, again, beautiful individuals are those who have all of the facial features, even non-dominant features, or most of them at least, are aligned nicely, and there's a good harmony between different segments of the face. The reason that the kids look prettier or younger individuals in general look good is because the facial harmony is better in those individuals and younger individuals. As we get older, in most incidences, that balance is distorted. And for example, the nose that used to look nice becomes larger. The kids usually never have a hump. The kids usually never have too wide of nose. And that's the difference, that's the distinction. And it is just part of the aging that some of the imbalances occur, and the oval shape of the face becomes more of a rectangular because the jowls develop, and that's not good. That's not really a balanced face. As we look at ourselves in the mirror day after day, subconsciously, we ignore some of the flaws, asymmetries particularly. For example, a patient who has a deviated nose often doesn't see the deviation. While when they have their picture taken, they see the deviation. And the reason that pictures are not usually as attractive as we think we are is because the picture depicts the flaws that we get used to it. Not only on us, in our spouses, in our children, and parents usually don't see the asymmetry in their children's faces. And when we consult these parents about the child who has craniofacial deformity and point out some of the flaws, they say, we don't see it. When we print a picture and show them, then they see it because they get used to it. And it is an incredible phenomenon in the nature that we have the power not to see the flaws and be focused on the prettier part of the face and see ourselves very differently. And that's, again, is something that we deal with all the time. And what we have, many of us who has been practicing for a long time, we have a mirror in our office that is called a true mirror, and it reverses the image. So when the patients look in that mirror, they see themselves the way I see them, which is very different from the way they see themselves in the mirror. So I don't sit across people and tell them what else they need, unless the reason that they are in my office to see me or surgery that I'm going to be doing for them is going to be suboptimal because of something else. If the patient comes to see me for the nose surgery and they have prominent ears, I'm not going to discuss the prominent ears. Or if they need some facial rejuvenation, I'm not going to discuss that. And this is something that we face every day. So we have to have some ethical rules about it. And we don't want patients to become concerned about something they're not concerned about it, unless, again, it's going to interfere with our ultimate goals. As a person who is specializing in the face, we absolutely have to be aware of one entity, and that is body dysmorphic disorder. These are the patients who do not see themselves the way the others see it, the way I see it, and they keep asking for something to be done. As long as the requests are realistic and the patient has healthy frame of mind, it is gratifying to deal with the patients. But when we get to a situation like what I'm suggesting, that the patients is going to require something else, as soon as you fix one thing, they're going to find something that they're going to be unhappy about. Those are the situations that we really need to seek advice of a healthcare practitioner who's focused on a psychological issue. And these are the patients that they're not going to really be happy with the face because they don't see their face, again, the way we do. And there's something that we all have to be aware of it and care for these patients differently. Sometimes I suggest the patient to go to see a psychiatrist, and if they refuse to do that, then I'm not going to operate on that patient. And sometimes they do, and then I've helped the patients in a different way. I've served the patients in a different way. There are patients that sit across me and ask me, what is that you can do for my face? And whether this is a rejuvenation or beautification, which is, again, in my view, is a good part of beautification, I'm going to analyze the entire face. We have actually a systematic way of analyzing, even visually. Then, as I mentioned with the life-size pictures, measurements and angles. And by adjusting those structures, we can, again, make the face to look prettier. Today, particularly with the availability of fat injection, a good number of our goals can be met with just fat injection on patients who have hollowed lower eyelids or less than ideal prominence to the cheek area, or thin lips, or even slightly under-projected chin or a slightly asymmetric chin. I can actually adjust those with fat injection. You were earlier talk about the fillers. Obviously, the difference between the fillers are two and fat injections are main differences are two. One is that fat is more lasting and essentially permanent. Nothing is permanent. And the other advantage of fat is that it has stem cells and restores the glow to the face that we cannot get from just skincare products or even lasers. That's an amazing benefit. And so a good number of facial unattractive features can be made more attractive just by fat injection. But we use we move the bones. We adjust the frame of the nose if we need to. And earlier I mentioned that we can even move the eyes apart closer to each other. But most of the time, other procedures that we do help us to achieve those major objectives, camouflage some of the major flaws without resorting to very complicated procedures. But the analysis part is, again, visual analysis, assessment of the face, and supplemented with cephalometric analysis using life-size pictures that we do actually measure the different distances. From every surgery that we do that has a function, the goal should be improving the form and function. And the reality is that good form always translates to good function. Facial beautification is something that actually we can do it even in the childhood, meaning there are boys or girls who have very prominent ear, and that doesn't change the function of the ear so much, but it is so protruding that they're getting teased about. So we start from that age. And we usually do that operation around age 7, meaning set the ears back. So that would be an example of, again, beautification. Obviously, we're not even talking about craniofacial deformity or cleft lip, hair lip situation. We talk about individuals that they otherwise have perfectly normal face, but they have flaws that can be detracting and can be a source of teasing that can be corrected. So in teenage, the most common operation that we do is a nose surgery. But I have had teenagers that have bags under the eyes, and that sometimes runs in the families. Or I have done removal of fat under the chin on teenagers that runs in the families. And no matter how much weight they lose, they're going to still have that fat protruding. I remove that, and that creates an imbalance on the profile, makes the chin not to look as defined as otherwise it would be. Every plastic surgeon is trained to do facial plastic surgery, to see the flaws of the face, to understand what beauty is about, and is qualified to work on the face. Particularly as we gain experience, it takes us in a different direction, and we narrow our field. Some plastic surgeons, they just do breast and body contouring, do not touch the face. Some plastic surgeons do hand surgery. And there are a bunch of us that we have limited our practice to the face area. And what we do is just focus on the beauty of the face and aging of the face, even some reconstructive aspects of the face. But as I indicated earlier, all plastic surgeons are trained to eliminate the flaws of the face and create more harmony to the face.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.